so bloated.
Yeah, me too.
I have to go home because my brother has mono and my mom has to work.
Well, you should know before you go. Thanks. Oh wait, you said mono?
I did say mono.
I have mono right now. It's not very.
Hey, Regan. Oh my God, what's wrong? My grandma has colon cancer.
I know how that feels. I had colon cancer about a month ago.
Have you heard of tuberculosis?
Oh yeah, I had that last year. Yeah, it wasn't very fun.
What are you doing?
Oh hey, I am researching consumption. I think I've got it.
I have to go pick up my halitosis treatment.
Oh, I need to go pick up mine too. I know I have that.
Do you even know what it is?
No, but I know I have it. Hypochondriasis is a mental disorder characterized by excessive fear of or preoccupation with a serious illness, despite medical testing and reassurance to the contrary. It was formerly called hypochondriacal neurosis. Hypochondriatic patients often think they have major illnesses and ailments that they don't have, but they truly believe in their minds that they have them. Mostly when people, they go to the doctors to, say, hey, I've got cancer or something, and the doctor tells them no, they don't accept that, and they will seek out other doctors. They will come back to the hospital, and that's also known as doctor shopping. That's a very common symptom. They often research or Google WebMD all the symptoms that they have, and they tend to take small, a headache, a slight cough, and turn it into pneumonia or a brain tumor. But that's often, of course, not the case. They just mentally know that they think that's what they have. Hypochondriasis is a somatoform disorder, meaning it's a mental illness, but it makes them think it affects their body, but there's absolutely no physical proof that that's happening. The causes of hypochondriasis aren't exactly known. It's very hard to predetermine if someone's going to have hypochondria because nobody knows where it comes from. Often the case is that children who maybe have a sibling with a major illness don't get enough attention, and therefore when they're adults they try to seek out that attention through their diseases. Another reason would be if their parents didn't care enough about them, then their only means to get attention is to act out like that. A third theory is that they've done something wrong in their life or something bad. They feel that it wasn't right, and in order to forgive themselves, they think that they deserve the disease that they're diagnosing themselves with, when really, they could be doing something else besides that. But that's how they express their emotions and how, unconsciously they're taking out what they did on themselves. As in our case study, a 45-year-old man believed he had gastrointestinal cancer. So he found a doctor, told the doctor his problem, but the doctor was like, listen, I don't know. And so the man really he was like, I want a colonoscopy, I want a CAT scan or something. And the doctor was like, well, I'll help you out if you need it, but we're not going to use that extensive of a surgery. We need something less extreme. And the patient was like, no, I'm going to go find someone else to do this because I truly believe in my heart that this is what is wrong with me. So that's another example of doctor shopping, and it just goes to show to what extremes and how truly patients believe that they have a serious problem. Hypochondriasis used to be mostly known in adults, but recently they've found it's developing in children, and a lot of that is because, children see their parents do it to the children. If the children ask, I have a stomach ache, and their parent freaks out and takes them to the doctor and says, I think my kid's got an ulcer, stomach cancer, and the kid sees that behavior and repeats it and almost conditions himself to react that way. So they're finding it in kids a lot more, diagnosing it early. It's the same, it's as common between men and women, it's the same. Treatment. Oftentimes there's what's called supportive treatment, because if doctors try to say, well, this is all mental, it's not actually real, the patient's not going to believe that, and it's not going to help them at all. Often there's anxiety and depression associated with hypochondriasis, so sometimes they are put on antidepressants or even placebos, so that they think they're getting some medical help. What else? Often if a doctor is trying to diagnose them, if they're trying to figure out if they do have hypochondriasis, they give them a full medical checkup to make sure nothing's wrong, and they refer them to a psychologist or somebody who can deal with that in a positive way. Family and friends mostly can talk to them about it, really, I mean, it does not help to say you're just faking it for attention. This is all wrong. You need to support them, you need to be there for them, and you need to help them along their journey. Cut. If you believe that you have hypochondriasis, or you have a friend that you believe might have it, it's ironically go to a doctor and just see what his recommendations are, and if you need to go find some group cognitive therapy or support therapy, and really just find out what you need to do to help them or help yourself. Where are my sunglasses? Or is that lame?
This is on me.
Hypochondriasis. Okay, I gotta keep my feet down.
To get home, my brother has mono and my mom has to work. Yeah. Thanks.
You're welcome.
Oh, you said mono? I did say mono.
Oh wow, I didn't press record.
Are you good? I've turned it all the way to
We
the
need a
left.
new stage.
Ah! Holy